Welcome back, guys. Today we're going to talk about the renal system. Renal system, as every system, is divided into embryology, anatomy, physiology, pathology, and pharmacology. Today we're going to start about talking about the embryology. The embryology of the kidney is divided into three parts actually: pronephros at the week 3, mesonephron at week 4, and metanephros at the week 5. But pronephros week 3 is degenerated, so it don't have any organ that reflects the pronephros. Mesonephrons is reflect the genital system in the male as a Wolffian duct and ductus deferens and epididymis. Metanephros, which is in week 5, as I said, is the most important part, and which it reflects the kidney and the ureters. So the metanephros is divided into two parts: urethric bud and metanephric mesenchyme. Urethric bud is responsible to give a branch for like the tubal part from the collecting duct to the uh, uh, from the collecting duct going back to the ureter. So it's gonna contain collecting duct, calyces and pelvis of the kidney and the ureters, and it's canalized by week 10 of development. Metanephric mesenchyme, which is responsible from the parts inside the kidney. So it's contain the formation the glomerulus and like Bowman capsule and uh, proximal convoluted tubule, lobe of Henle, distal convoluted tubule, and the rest, as I said, it is urethric bud. But we have an interaction between these two tissue, which is a metanephric mesenchyme and urethric bud, which can sometimes making a congenital defect if it's not properly. So, like renal agenesis, multicystic dysplatic kidney, and ureterobulbic junction last canalization, leading to congenital obstruction. Can be unilateral or bilateral. Most common pathological cause prenatal hydronephrosis, which is enlargement of the kidney, detected by prenatal ultrasound. One of these important congenital defects happening in the kidney is the Potter sequence. Potter sequence is pulmonary hypoplasia, which caused by oligohydramnios. So oligohydramnios can cause a compression of developing of the fetus, leading to limb deformities and facial abnormality like twisted face and twisted skin and twisted jaw, which called retrognathia, which is like here is like the jaw going backward, so it's called like twisted jaw, or called in a medical term is a retrognathia, and the flattened nose because of the compression of the chest causing pulmonary hypoplasia, and this one main the cause of the death, which is a pulmonary hypoplasia caused by chronic placental insufficiency or reduced renal output, including uh, ARBKD, acute recessive polycystic kidney disease, and obstructive uropathy like a posterior urethral valves, which we're going to talk about later, and bilateral renal agenesis. So we have in a like Potter sequence is like shortcut for P for pulmonary hypoplasia, O for uh, oligohydramnios, T for twisted face, twisted skin, and E for extremity defect like a twisted hand and foot, and renal failure is the end.